What Richard doesn't know about ultrasound machines isn't worth knowing, so I will hand straight over to him and he can carry on.
So my name's Richard. I am a radiographer, I'm a sonographer, and I'm a vascular sonographer. I've been the clinical apps for Nottingham area for the last 5.5 years. So if I've met you before, hi, and if I haven't, this is the first time you've seen me without a mask as well. You've bought 9 of these systems. So you should see quite a few of these rolling out cross-site. I'm a bit weird in that I show the back of things first, so this is going to involve quite a bit of tilting by James to show the back using the camera.
So apologies for the amateurish camera.
So at the back, at the bottom, there is a lockable drawer, so you can put a padlock at either side, put controlled drugs and needles in there, close the drawer, and then obviously wheel it to your location of choice. The power socket has been moved up from the lowest slot on the old systems and moved up with a clip at the top here so that you don't run your power cables over repeatedly. There is a cable tidy at the back. If we undo all of that and unclip it, the bucket can literally just lift off, take all your bits and bobs out that you might want and wash that out. So that's really good from a ease of use and cleaning point of view. The system itself has got a 3-hour battery life if you've fully charged it, so it's recommended that you charge it when it's not in use. All the old Sonosites were 1 hour only, so it is a much longer battery life, but it obviously relies on the classic of you actually plugging it in. The power button is round the back, so that's on purpose so that you don't switch it off accidentally mid-procedure, or if you're asking an ODP to press buttons for you. The ancient systems, the power button was near the new patient button, which was a bit annoying. Boot up sequence, so if you press it, it's just a 1-click and press, and it's a 45-second boot up time compared to the older systems that were 25 seconds, so it is a little bit longer. You get an initial screen. The screen will drop off after a short time. Don't start pressing the power button repeatedly because all you'll do is switch it back off again. So it starts up with the Sonosite screen, it'll go blank, and then it will bring up the Sonosite PX screen, and that's normal. If you've used the Sonosite Export, you'll be familiar with the screen that's going to pop up, which is, I call it the 4 buttons of dreams, which is the ones you're about to see. So we get, if you just want to get in for a basic scan, press scan, and that'll let you scan immediately. I'll bring this a bit close. Patient demographics, if you wanted to put that in, can change the probe. So with regards to the probes, different systems have got different probe sets on it. So I've brought one round that has got all the probes on it. So essentially there's the standard sort of shape and size probe. This is a new version probe. So this will go 9 centimeters down, will this 12.3. So that's for your high BMI, deep blocks, vascular access, more interestingly deep cases. This one is a new one. So if you've ever had the L25 probe, this is a brand new, much higher frequency probe. So this is 19 to 5 megahertz, which is ridiculously good imaging. Don't be put off by the small probe face. You can still do carotid area, subscapular area, things like that. And curvilinear, which is a lower frequency range. So this will be better imaging at depth. So this is 30 centimeters deep. This one is 6 centimeters deep, so it's called probe roulette. You pick the one that's going to do the job for you. The other one, so you guys, I'm sure majority of your consultants, you know what you're doing, but that doesn't mean everybody knows what they're doing. So there is an onboard learning feature on this. The Export had 80 learning videos. This has 156 videos. So as soon as you press learn, it separates it out into basics that a sonographer like myself would say. If you think the system's been a bit funky and should it be doing it, there's a system area. Then A&E, if you can't see the body part that you're interested in, you can scroll across and find a video that suits you. Obviously, you guys are in anaesthesia, but don't ignore procedures. So in procedures, that's got things like PICC lines, radial access, femoral access. Whichever video it is you're interested in, select it. It will run a video and it will always warn you saying that this is not going to make you competent.
In your array transducer with a V.
You can't change the woman's voice, so you can't put Jeremy Clarkson or some of the dulcet tones on there, but you can mute her. If you've got friends that you want to scan, so like today that's an audit MDT day, press scan along. This will unmute her,
Placed transversely.
but you can again pause it. And at this point, the probe is now live, whichever one is active. So we've got a 12.3 probe. Hopefully you can see my finger running across it. So basically you can copy whatever is happening on screen. If you've missed a bit, you can skip back 15 seconds, restart the video, move the video around in case there's a button that you want to get to on a touch screen, maximize the video or exit it. From the 4 buttons that you saw initially, so the scan, patient demographics, pick a probe or learn, those buttons still exist on this touch screen now, so you can put demographics in after the event. You can change the probe, so if I press this, so if the linear probe here wasn't the one you wanted and you wanted the little linear probe, press the button. Similar to export, it gives you a picture of each one. So there's 2 that look very similar. So we've got the linear L12.3 and the 19.5. We'll go to the 19.5 just to show you how good this is. So this is now down to how good this camera is. So we'll use and abuse me because this is what it's all about. So down here, there's persistent controls. So you've got depth, gain control, freeze, take a picture, take a video. Your Doppler controls and your M mode controls are at the bottom. They're always there. So that's an improvement versus export where it was on a touchscreen and it might have disappeared from the screen. So what I'm going to do, I'll get as close as possible. So the game-changing thing with this, if I, again, bring this as close as I can so you can see how good this is sub-centimetre now. So on all the old Sonosites, the closest you could ever get before was 1.5 centimetres. So that's literally all I've done is change the depth. If I turn the gain down so it doesn't look as bright on your screen, we've got nerve bundle in the middle. We've got radial. If I just put a bit more gel over here, where are we? I've got radial here. So I've got radial in the middle. It might be the biggest radial if I just turn in plane on that. So hopefully you can ascertain that I'm an adult and not a paediatric, but sub-centimetre is going to open up a lot of things with the smaller candidates of yours. Then if I go further up my arm to do peripheral access, so this is literally just me on me. We've got my superficial vessels. If I roll interior or medial, we've got artery with a vein. Pressing the Doppler controls, you can move that around. If it's a vein, don't assume that blue is venous, because all I have to do is tilt the probe the opposite way and suddenly it's red. To get out of everything, I'll just move this back a bit so you can see. 2D is the button to get you out of most options, which is at the bottom corner. Sorry. On the touch screen, you've got options such as centerline. The centerline is also on the curvilinear probe now, which it's never normally been on a Sonosite. It's giving you the line on the probe, but it's not giving you the actual thing on screen to select. So that's just a straight line on screen that does not enhance your needle. The needle enhancement is this needle profiling technology. So press it and you get the yellow line. What you want to do is aim the needle either towards the dotted line vaguely or straight down. So out of plane or in plane, it should enhance the needle. This is where normally I would show you a bit closer. So this is down to whether my phone is going to project this very well or not. So essentially, that's this system with a full needle going in. That's in plane, out of plane, and I've got a short video loop of me doing a out of plane only, and then in plane with a out of plane final bit. Just obviously it depends whether you're doing tap blocks or your preference is to do an in plane and then do a final rotation 90 degrees to get you out of plane. All Sonosite products, whether it's old or new, can be dropped. So apologies for my Yorkshire accent on this one.
There's one thing that Sonosites can't do, and that's cope with having needles stuck into the head of the probe. So be very, very careful when you put the needle through the skin. If you're at all worried about it, pull the probe off as you put the needle into the skin and then put the probe back down, because we've lost loads of probes from people sticking needles into the tip of them. Please don't.
Yeah. So stab people, not probes. They're about £5,000 each if you needed to replace them out of warranty. The warranty is 5 years, and that's to cover unlimited swap out of probes, unlimited swap out of systems, and this top bit, if I just zoom away, the top bit where the probes plug in, that's also 5 years, but it's within normal use. So if you've taken it to a car park and run it over and it's got tyre marks on it, then it's not covered. If you've stabbed it, chopped the cables, then that's not covered. So within normal usage, it should be very, very durable. It is battlefield grade, but that doesn't mean it's unbreakable. If you're ever in a menu that you think, I don't know how to get out of it, find the blue option and then just deselect it. This is the first system where if there's a button and you think it's complete jargon, there's an information button on it. So we've got one here that says optimize. Essentially, that's the frequency changing part of the system. So resolution is thinking we want the highest resolution for low BMI close to the surface of the skin. General is your bigger person. If we go to the curvilinear probe, there'll be another option for that, which will be penetration. So that's your high BMI bariatric option. So it's dropped the resolution preset off, and we've got a penetration setting. So that's your high BMI one. If you hadn't a clue what all that meant, press the information button on it and it will explain it. Maybe a bit jargony, but that's where it is. If you've scanned anybody, take a picture. So I'll just, again, use and abuse me, because that's what I'm here for. And I'll be as quick as I can. He says, so we've got an image on screen. You can take a picture as you go. You could freeze it and roll back. So that's the cine loop. So you can use the trackpad, the gain twiddle to rewind and save a picture there. If you want a video loop, the first thing you probably want to do is change how long the video is for. So press more controls, scroll up, find the one where it says video clip settings. Most people like a 6 second or more clip. Your choice of whether it's prospective or retrospective. Press video clip and it will start running the clip. Makes a beep. There's a little camera sign and it will beep when it's finished. First Sonosite that gives you the thumbnails of what you've done, whereas other ones will just give you a beep. If you need to look at it, press it once. You go, oh yes, that's brilliant, I like that. Oh, that one's blurred, we'll get rid of it. So use the selection key to select it and delete it, and that will just delete one part of the study. Videos, it will run the loop. You can slow that down from full speed to half speed, quarter speed, or pause it part way through. Use the slider to rewind to wherever you might want. If you've got any thumbnails here and you finish that person, you should always end the study, else what you're going to end up with is a folder full of thousands of images that don't relate to everybody you've scanned. So press end study, press yes, and you will go back to the starting point, which is the 4 buttons of dreams. And if you've done lots of scans that day, and some of them are interesting, this is from a training point of view, to get to the hard drive, press scan. Your hard drive is this one where it says patient list, and it will show you everything that's ever been done on it. So we've got Messu's clinical testing, the one we've just done, so it organises it in date and time. Select it, and at the bottom you can look at it by pressing view. We want to look at the images and confirm it's what we thought it was. We'll give it a thumbs up and said, yes, it is what I thought it was. At this point, you think, right, I want to get that off the system. So select it. The option you've got at the minute is to send it to a USB stick. If you wanted, this can be hooked up to PAX, either wired or wireless, but that needs obviously permissions granting by the PAX team. So what you want is a stick, pop it in. You've got USB 3.0s and 2.0s at the back. It's found my stick. It's ready to go, so we'll press it. When it's done it, there'll be a little icon come up here as the one below, and there'll be a message on screen saying export complete. It's really fast if it was just images. When it gets to be videos, it does take a little bit longer. The file types are JPEG for images and MP4s for videos, so whether you're on a Mac or a PC, it shouldn't matter. The other thing on screen that we've never shown you before is how long's left on the battery. So at the minute there's 2 hours and 45 minutes at the bottom here. Transfer's complete. If you plugged it in, you can use it on mains if you want as well. When you've got it off, so it's now complete, take it off the system, so that's clinical governance. Get rid of it as soon as you possibly can. Once you've definitely got it off, to switch off, single button press for the power button, screens go off, Clinell over the screens is fine, Clinell on the probes is fine. If it gets a sheen on it, like most screens normally do, just a damp cloth with water, then followed by a dry one will get you back to mint condition screens, and you should be able to see the clinical image from nearly 90 degrees away. And I think that's time on me, so thank you for your time. There will be a YouTube video link of my colleague Laura who goes through this as well.